In this presentation, I will be basically dividing my talk into 5 parameters: history-wise perspective, the basics of time-lapse technology, the morphokinetics, what should one look at when they are selecting a time-lapse technology equipment, and what are the list of recommendations and key articles in this area. All of us have seen in reproductive medicine a lot of technologies come and go, but there are only 4 major technologies for our reproductive fertility which have stood the test of time. One is the in vitro fertilization, the second is the intracytoplasmic sperm injection, the testicular sperm extraction or aspiration, the vitrification, and most probably time-lapse technology might be the 5th one, but only time will answer that question. We think technology is a word which we use for new things, but it is almost close to 90 years since the first publication on time-lapse technology was applied. It was applied by Lewis and Gregory on rabbit eggs, and it was published in the Science Journal in 1929. So, it is only with the advent of improving technology, computing sciences, and the data storages and the miniaturization of the equipment has made time-lapse technology what it is today. But when it comes to the human studies, it took almost lot of years, and the first work that was done by Diane Payne in 1997, where she used the incubator with a single inverted microscope, and she studied 50 oocytes and then studied the cytoplasmic wave pattern, the appearance and the disappearance of the pronuclei, and said that these will be the predictors. But as pioneers, they are ahead of this time, and it took the rest of the community to grasp the knowledge that was kept in 1997, and it was many years later it was started being used at a bigger scale. And then you have a classic publication which was published in 2010 by Wong, who did a non-invasive imaging of human embryos before embryo genome activation to predict the development to the blastocyst. What he did was, he basically looked at 3 parameters: duration of the first cytokinesis, the time interval between the first and the second mitosis, and the synchronicity of the second and the third mitosis, and then correlated that development to the blastocyst stage development. This is the classic paper which everybody who is interested in time-lapse technology should read. And in subsequent work, he further went and then did mRNA studies and gene studies to look at which of the genes are activated at different timelines. Here you see the timelines in which, and these are the genes that are activated, and this happened in 2010. And when you look at, in summary, the time-lapse technology before 97 was a single point morphological assessment, wherein the inverted microscope was kept in the incubator and then monitored. By the time it came to 2010, as embryos were started being developed to blastocysts, the continuous embryo monitoring system started developing, and the commercial available models have started coming in from 2009, and from 2011 there was a slight increase in the jump of usage of time-lapse in different parts of the world, but their usage was less than 1% in the total clinics in the world. And since 2018, these algorithms have become automated, and these equipment had undergone further refinement. So, in time lapse you have 3 phases. One is the crude equipment of the microscope kept in the incubator, then the continuous monitoring, the manual algorithm, now the automatic algorithm, which is making a difference. Here I am going to show how a time lapse monitoring embryo looks like. Here you are seeing the right side is the number of chambers that are there for the embryo, and this is the time sequence of hours as it progresses from the fertilization to compaction to blastocyst. So, everything can be recorded for all the oocytes. The model which I use it has 1 chamber for 1 patient, and it has 16 wells which can contain 16 oocytes for 1 patient, and then they can be monitored in this way. When we look at the parameters that are there for time lapse, you have the time dependent procedures on the top, wherein the appearance and disappearance of the pronuclei, the cleavage cells, the blastocyst formation. Then you have the fragmentation parameters, and these are divided into the timing events and the abnormal cell events, which can predict a particular embryo whether it is going to give a reasonable chance of getting a pregnancy. What is the role of a time lapse technology in an ART clinic in 2020? It is basically used for an embryo assessment. The second area is it is also used to predict the fertilization events and then look at the possible cleavage patterns and the blastocyst development. It is also used to train the embryologist so that there is less observation bias, and an average embryologist can become a top class embryologist with the use of time lapse technology. And the other area is there is a whole world of opportunities to do research in the area of time lapse imaging, because it is still in the nascent phase. And the last but not the least is the comparison that is coming in is the role of time lapse technology and the embryo aneuploidy, which are 2 parallel technologies. With time they might merge together as a combination of a procedure. In the morphokinetics, that means the morphological patterns in relation to a timeline scale, as on date 28 parameters are identified, but the scientific community is able to analyze 4 to 6 parameters and then predict the embryo development. With time, this method will become more robust and more efficient. So, when you look at the timeline parameters at the fertilization point, you see the polar body emission, the appearance and the disappearance of the pronuclei, the halo appearance, then the disappearance of the halo, then the pronuclear breakdown and the cleavage. These events in the first 24 hours are becoming predictors of the day 3 embryo and the day 5 embryo. So, a time will come on the end of day 1 or day 2, we might have quality information saying these are the embryos which will help us to go to blastocyst, and you can also transfer them on day 3 or day 2 depending on the country laws. Here the green lines show that these are already scientific data that shows the predictivity parameters for green line are already proven in publications, and the red lines are not yet predictive. What does the scientific data say? The scientific data says that focused time lapse analysis reveals a novel aspect of human fertilization and suggests new parameters of embryo viability, in which a pronuclear formation characteristics are assessed, the cytoplasmic waves are analyzed, the evidence of the halo of the cytoplasm to predict the implantation potential. There is another paper which says a possible biomarker non-invasive time-lapse technology might be in future a possible biomarker to identify embryo to predict live births. So, the evolving technology is moving from minimizing the number of embryos and also predicting their implantation potential, so that with time we will be able to reduce the number of embryos we are going to transfer and also select the optimal embryos. Here I am showing a video where the pronuclei did not disappear at the right time. This is on the right side the wells of the patients, and one of the well we selected, and this is the oocyte, and this is the timeline at the bottom. So, I am owning the flow. So, normally a pronuclei should disappear around 18 to 23 hours, and in this case it did not disappear, and subsequently you see that embryo getting bad. These are the two pronuclei you see here, and this is the timeline you are seeing here. So, some of the parameters will give you an impression as early as 24 to 48 hours that the embryo is going to become bad. You have seen the fragmentation because the pronuclear disappearance is delayed and there is an abnormal cell division. So, the predictability of the embryo is becoming more efficient by the use of time lapse technology using the fertilization events. Normally what happens is we have the embryologist calling the clinician and saying on day 3 the embryo is fragmented, but in actuality you will be able to know that information by the end of 24 hours because the pronuclei did not disappear at the right time. Sometimes we end up transferring them on the 3rd day thinking that this embryo will not go to blastocyst, but in fact it has a basic cell division abnormality. Here I am showing the diagrammatic view before we go. Here there is a reverse cleavage of the second polar body, a diagrammatic representation. So, which is combined as 3 pronuclei, and then it started dividing. If we do not look at this information, we might end up transferring this embryo as a good embryo and then thinking as this is the abnormal fertilization with 3 pronuclei. This is the timeline you see at the bottom. These are the pronuclei you see. These are the 3 pronuclei you are seeing. In XC, we used to wonder how 3 pronuclei used to come in, but here it is internalization which is causing that thing, and if we see the embryo at this point, we say it is a good 2-cell embryo, and we say things are all right, not realizing that we have missed a 3-PN parameter. At the end of 48 hours, you are seeing a 4-cell embryo. And it looks as if it's a grade 1 embryo, and we will say that we transferred grade 1 embryo and the embryo did not implant, but in fact it was having an abnormality of the pronuclei which will not produce an implantation. Even if it implants, it will produce a pregnancy loss. You see a compaction and later you will see a beautiful blastocyst. And all of us will, when we look at these photographs, will say it's a beautiful blastocyst and we did not get a pregnancy. The other areas where you have is an abnormality of the cell divisions, where it can be a trichomonas, a 3-cell division or tripolar division, whereas it will end up producing an abnormal genetic material, which here the oocyte with the sperm, it's the fertilization and the 2PN, and the first cleavage happened and there is an extra genetic material. That cell remained throughout the embryo development as an extra cell, which you will see in the video. It's the same video wherein this is the timeline at the bottom, this is the 2PN. Disappearance of the 2PN, then you sell 2 cells, then you see an extra third cell that is coming in, and it's not a vacuole because of the size of the cell. And that cell remains at the same position throughout the cell division. And any embryo which has a tripolar division has a lower implantation potential. If you observe this, this is a cell that has gone the changes. At 80 to 90 hours it underwent compaction, but the extra cell remained in the same position. And if I have 2 normal embryos which are perfect and this embryo I would not transfer, but it will look like a beautiful blastocyst. So these are the events we are missing at this point of time. And there is one more thing called reverse cleavage. That means a cell goes into the next cell division and then comes back to the previous cell division. Here you are seeing the 2PN. Here these two have fused together and the other cells went on ahead with the division. This is the same video of that graphics. This is the horizontal timeline which shows the time scale. Here you see a 2 cell, then a 3 cell, then becoming again a 2 cell. So this is called a reverse cleavage pattern, and these embryos most of the time will be genetically abnormal, and they are avoided. The transfer is avoided if other embryos are good embryos. and you can see the unequal size of the blastomeres or the abnormal cell division. When these are some of the examples of the time-lapse technology images, wherein you have the fertilization events which are predictors, then you have the cleavage events which also are predictors for the ultimate implantation and the live birth rate. And when somebody is moving from a MINC incubator to a time-lapse incubator, they have to look at following conditions. The conditions they should look at is the type of culture systems they have, the workload they have, whether they are using the humidity system or the dry system. And when somebody plans to buy a time lapse, my advice will be they should understand the pros and cons of a time lapse system, because there are different types of time lapse systems. The safety profiles are different in each of the system depending on whether the type of light that is used, the number of frames the camera has to be taken, and the number of microscopes in the chambers it gives, and the type of morphometric algorithms that are given in, which makes a decision in buying a time lapse technology. What are the components of a time lapse technology? It's basically an incubator with one or more inverted microscopes integrated with a coupled digital camera with integrated time-lapse software. And this is a diagrammatic representation of the time-lapse system. The light source is different for different companies. Some use the red light, which is safer. Other people use the blue light. A few people earlier used to use the green light. The second thing is, this is the chamber which has the culture media, and the culture dishes are different from different companies, and they don't match. One culture dish does not match the other system. The third thing is, the media that is done in most of the time lapses is a single culture, 5-day culture media. There is nothing wrong in using a 2-step culture, but the quality of images might come down. So when you are selecting a time lapse, you should look at how many chambers are there so that it gives adequate workload. Second thing is, what is the type of the wells that are there and how expensive they are, and for how many of your patients each incubator is needed, and that should be looked at, because in anxiety and in a hurry sometimes we buy a time lapse system technology and then realize it is not adequate or not fulfilling our requirements. So looking at all these parameters is important. At this moment there are six models available worldwide with different specifications and different costs and different safety features. We have one system wherein the time lapse system is placed in a conventional incubator. You have a second system where it is kept in a compartmentalized with connected system, and you have a third system where it is individual compartments and individual microscopes for all the chambers. As this progress of improvement comes in, there is a safety is there. At the same time, the cost piles up from the beginning of the top of the arrow to the bottom of the arrow. That should be also taken into consideration when they are buying a system. What are the things one should consider when they are buying a time lapse system? What is the workload they have? What is the cost of the equipment? What is the type of humidity, whether it is dry humidity type of time lapse or the humid condition? What type of gas mixing is needed? What are the types of culture plates are needed? Then one should also understand the type of microscope and the type of culture media that is used, because the the algorithm is designed for a particular culture media and a particular system. So, that may not work with other systems even though the vendor says it works well. It needs again fine tuning, and how much of work you have, and so that if you promise a patient that you are doing a time lapse and your incubator is full, you end up with an unsatisfactory patient. What is the global status of time lapse technology at this moment? At this moment, the commercial systems have started coming in 2009. Scotland is one of the few countries where it has invested for all their public funded clinics to do total time lapse thing. In US, 17% of the US clinics use time lapse technology. In France, 39% of the clinics use time lapse technology, and India, it's in the very early adoptive phase. The other thing is, with the advent of AI, the predictions are becoming more and more efficient, and in another couple of years you see much more robust systems of predictions of the algorithm to make your selection much more better and allow you to use less number of embryos. What is the role of time-lapse technology and aneuploidy? Till date, 13 studies were done on time-lapse technology and aneuploidy, and the answer at this moment is they are parallel systems, but there is a suggestion that is coming in from some of the workers that you do a time-lapse technology, select the best embryo, and then do a pre-implantation genetic diagnosis to that embryo, so that you are not wasting that embryo, and you are doing it for very few embryos which are time-lapse morphokinetically normal, so your process is efficient. That is one other thing. The other area is non-invasive pre-implantation genetic screening combined with morphokinetics or time-lapse technology are the future steps that are coming in the next 1 or 2 years. And when we look at our experience, we started using time lapse from September 2019. Our whole understanding of embryology has changed. We are able to reduce the number of embryos that are transferred, and we are also scoring the embryos which we are freezing, so that we are able to transfer embryos which have better morphokinetic parameters, so that the embryo implantation is there. Last but not the least is, when a cycle fails, we are able to go back to the film and look at where did things fail. So, the failure analysis part is also helping us. If the embryo is perfectly fine, then I might look at immunological causes or uterine causes as a cause for failure. So, the summary is, it predicts blastocyst formation. The data is at the moment divided that it will give a good prediction on live birth. Regarding replacing pre-implantation genetic diagnosis as a tool, I am not sure, the data is not complete. And in March this year, the SRA has brought a good article which they published in Human Reproduction Open, where they gave good practice recommendations on the use of time-lapse technology, which is an exhaustive and excellent article. And any person who is planning to invest on time-lapse technology should read this article before they invest on that. And I say a warm thanks from Visakhapatnam, and personally we have learnt a lot using time-lapse technology, and it has reduced the number of embryos to be transferred and also made our frozen embryo transfer protocol more efficient.